Hello, and welcome to a show where we delve into the intricate, often infuriating world of something that should be a basic human right, but somehow got twisted into a luxury healthcare. Today, we're focusing on one of the most controversial aspects of the American healthcare system, the exorbitant cost of prescription drugs. Specifically, the sky-high price of prescription drugs in the U.S. It's a topic that affects millions of Americans every day, from the elderly, who rely on life-saving medications, to the young families struggling to afford basic healthcare. It's no secret that Americans pay far more for their medications than people in other developed countries. In fact, the price disparity is so significant that it often leaves people wondering how such a system came to be. We're talking about a system where people are forced to choose between their health and their financial stability, a dilemma that no one should have to face. Imagine having to decide whether to buy groceries for your family or the medication you need to stay healthy. Where a trip to the pharmacy can feel like a trip to a pawn shop. The anxiety of not knowing how much you'll have to pay out of pocket can be overwhelming. Over the next few minutes, we're going to unpack this issue by comparing the cost of common medications in the US with their prices in other countries. We'll look at why these prices are so high and what factors contribute to this disparity. We'll examine the reasons behind these staggering price differences and explore the impact this has on everyday Americans. From the role of pharmaceutical companies to the influence of government policies, we'll cover it all. Buckle up, because it's going to be a bumpy ride. But by the end of this journey, we hope to shed some light on this complex issue and perhaps even offer some hope for change. Let's start with a drug that's literally a matter of life and death for millions of Americans: insulin. This isn't just any medication, it's a lifeline for those with diabetes, a condition that affects how the body processes blood sugar. Without insulin, many diabetics would face severe health complications, even death. It's a hormone that the body needs to convert sugar into energy, and for those who can't produce it naturally, synthetic insulin is the only option. This hormone, essential for regulating blood sugar levels in people with diabetes, was discovered over a century ago. The discovery of insulin in the early 1920s by Dr. Frederick Banting and his team was a groundbreaking moment in medical history. It transformed diabetes from a fatal diagnosis to a manageable condition. The initial goal was to make this life-saving drug accessible to everyone who needed it. You'd think that something so vital, something discovered so long ago, would be affordable. You'd be wrong. Despite its age and the relatively low cost of production, the price of insulin has been climbing steadily. Patients are often left in a state of shock and frustration when they see the price tags. It's not just a minor inconvenience, it's a financial burden that can lead to difficult choices between health and other essential needs. The average price of insulin in the US has skyrocketed in recent years, with some patients paying upwards of $300 per vial. This is a stark contrast to the original vision of making insulin widely available. The high costs are forcing many to ration their doses, skip meals, or even forgo the medication altogether, putting their lives at risk. Now let's hop across the border to Canada, shall we? Just a short drive away, our neighbors to the north have a very different experience when it comes to insulin. Our neighbors to the north pay a fraction of the cost for the same insulin. In Canada, the government regulates drug prices, ensuring that essential medications remain affordable for everyone. This means that Canadians don't have to worry about the same financial strain that Americans do when it comes to managing their diabetes. We're talking less than $30 a vial. This stark difference in pricing is not due to a difference in the quality of the medication, but rather the policies in place to protect consumers. That's right, a tenth of the price. It's almost unbelievable, but it's the reality for many Canadians. This price disparity highlights the significant impact that government regulation can have on the affordability of essential medications. It's enough to make you want to pack your bags and move to a country known more for its maple syrup than its affordable healthcare. The thought of relocating just to afford a life-saving medication is a testament to the broken system in the US. So, why the massive price difference? It's a question that many patients and advocates have been asking for years. Well, it's complicated, but a big part of it boils down to a lack of price regulation in the US. Unlike Canada, the US does not have a national policy to control drug prices, leaving pharmaceutical companies with the power to set prices as they see fit. Pharmaceutical companies in America have the freedom to set their own prices, and they often do so with little transparency or regard for the financial burden it places on patients. This lack of oversight allows for significant price hikes, often justified by the companies as necessary for research and development. It's a system that prioritizes profit over people, and it's leaving millions of Americans struggling to afford a life-saving medication. The consequences are dire, with many patients resorting to dangerous measures to stretch their insulin supply. It's a clear indication that the current system is failing those who need it most. Next up, we have the EpiPen, a life-saving device for those with severe allergies. It's a small, portable injector that delivers a dose of epinephrine, a medication that can halt a severe allergic reaction in its tracks. Imagine this: you're at a restaurant enjoying a peanut butter brownie because you're a rebel who laughs in the face of danger, savoring every bite. When suddenly your throat starts to close up, panic sets in as you realize you're having an allergic reaction. You're having an allergic reaction, your heart races, and you fumble for your EpiPen. You need an EpiPen, and you need it now. This small device is your lifeline, your only hope to stop the reaction before it becomes fatal. But in the US, that life-saving injection could set you back hundreds of dollars. The price has skyrocketed over the years, making it unaffordable for many. Meanwhile, across the pond in the UK, the same EpiPen costs a fraction of the price. It's a stark contrast that highlights the disparities in healthcare systems. We're talking less than $50 compared to the hundreds Americans are forced to shell out. This price difference can mean the difference between life and death for some. It's enough to make you want to trade in your baseball cap for a bowler hat and start speaking in a British accent. But why is there such a huge price gap? The reason for this price discrepancy? It's a complex web of factors, but it boils down to one main issue. You guessed it, a lack of price regulation and a whole lot of corporate greed. Pharmaceutical companies in the US have the freedom to set their own prices, often leading to exorbitant costs. Pharmaceutical companies argue that these high prices are necessary to fund research and development. They claim that without these funds, innovation would stagnate, and new life-saving drugs wouldn't be developed. But when CEOs are raking in millions in bonuses while people are rationing their life-saving medication, it's hard to take that argument seriously. The disparity between executive compensation and patient affordability is glaring. It's a harsh reality that many Americans face. They are forced to make difficult choices, sometimes risking their lives because they simply can't afford the medication they need. The price of breathing shouldn't be this high. Now, let's talk about cancer treatment, a topic that hits close to home for far too many of us. The cost of cancer drugs in the US is astronomical, often reaching hundreds of thousands of dollars per year. For many patients, affording these life-extending treatments is simply impossible. Now, let's jet set over to India, a country often associated with affordable healthcare. The same cancer drugs that cost a fortune in the US are available in India at a fraction of the price. We're talking about price differences so significant that some Americans are resorting to traveling abroad for treatment, a concept known as medical tourism. How can this be? Well, India has a robust generic drug industry and a government that negotiates drug prices. It's a system that prioritizes patient access over corporate profits, a concept that seems radical in the US. Even common antibiotics, those everyday drugs we rely on for everything from ear infections to urinary tract infections, are caught in this price-gouging web. A course of antibiotics that might cost a few dollars in Mexico could set you back $100 or more in the US. That's right, a simple trip to the doctor for a common infection could end with you needing a loan to cover the cost of medication. It's enough to make you want to build a wall, not to keep people out, but to keep Americans in until they've paid off their medical debt. The reasons for these price differences are complex, but a lack of price negotiation power and a system that allows pharmaceutical companies to game the system are major contributors. Finally, let's talk about cholesterol-lowering drugs, medications that millions of Americans rely on to manage their heart health. These drugs, while essential for many, can be incredibly expensive in the US, often costing hundreds of dollars per month. Now let's hop on a plane and head down under to Australia, a land of sunshine, surfing, and surprisingly affordable healthcare. The same cholesterol-lowering drugs that cost an arm and a leg in the US are available in Australia at a fraction of the price. We're talking about price differences so significant that you could probably finance a whole vacation to Australia with the money you'd save on a year's worth of medication. The reason for this price discrepancy? Australia has a government-run healthcare system that negotiates drug prices, ensuring that essential medications are affordable for all citizens. The high cost of prescription drugs in the US is a complex issue with no easy solutions. But one thing is clear, the current system is unsustainable. Americans are being priced out of their health, forced to choose between paying for life-saving medications and putting food on the table. We need to demand better. We need to demand transparency in drug pricing, fair competition in the pharmaceutical industry, and a healthcare system that prioritizes patients over profits. What are your experiences with the high cost of prescription drugs in the US? Share your stories in the comments below, because only by shining a light on this issue can we hope to find solutions that work for everyone.